Administrator Jackson, can you, I think in response to some questions from Chairman Barton, from Ranking Member Barton, you cited the criteria used in the endangerment finding of acidification of the oceans, agriculture production, and increased weather. Do I recall that correctly?
Those are some of the criteria I listed, Mr. Solomon.
But really, for an endangerment finding, aren't we required to see an effect on human health?
It's public health and welfare. There were two standards.
Can you give me an idea of the number of deaths in this country, either last year or the year before, the outsized number that would occur because of the increased acidification of the oceans in those years?
Well, I don't think we made an assertion that there were deaths associated with increased ocean acidification last year.
But
so I shouldn't have to defend a number.
For there to be an endangerment finding, though, there should be human endangerment.
Well, but that's not the only criteria by which to make that determination, sir.
Well, what is the amount of carbon dioxide that is safe?
Well, it depends on what you mean by safe, sir. People have talked about a level in the atmosphere. I've heard 350 parts per million. I've heard 400, 450. Scientists use very complex models to try to determine, as that percentage of CO2 increases and CO2 equivalence increases, what that would mean for rising sea levels, what that might mean for changes in our climate. So they try to work backwards to protect what level. To protect
OSHA,
what levels
if I could just stop you there for a minute, OSHA has a level of 5,000 parts per million, or half of 1%, as being an acceptable level. NIOSH says 30 parts per million, though I don't know that anyone actually recommends that. So there is a wide degree of latitude amongst the federal agencies at the level of carbon dioxide, which actually causes damage to human health.
Well, that's apples and oranges, sir. I think the ocean numbers you're looking at are what you could breathe in if you're being occupationally exposed on a short-term basis. Those are probably STEL numbers that would make you not able to breathe and therefore might harm you permanently, might kill you. Whereas what I was referring to when we deal with climate change is what numbers would try to stop the trajectory and the changes in our atmosphere.
Maybe then you could help us by saying what does the EPA use to assess the health impacts of, say, carbon dioxide and any of the other greenhouse gases, but carbon dioxide, since that's one we're talking about.
Right. EPA did not set a health level per se or an ambient air quality standard. What EPA did was look at what projections of the changing climate would mean on things like diseases that are carried by insects that might now be able to thrive in an environment where once there was winter weather that might kill them off, or exacerbation of impacts that are weather dependent. So a great example is smog or ground level ozone, which on warmer days is much, much worse for you and your lungs and causes increased morbidity.
Well, let's go to the vector-borne diseases, since you brought that up. Does the EPA have any peer-reviewed procedures that it uses for assessing the threat from vector-borne diseases?
Does EPA have, what EPA did was use the studies, peer-reviewed studies by those who for a living, study vector-borne diseases and the incidence and potential incidence of those increasing.
And what is from a number standpoint, what is the impact on human health that we're likely to see?
Yeah. So I think maybe the endangerment finding is, think of it as a weight of evidence, that all these things move together, but there are no numbers of people who are going to die from vector-borne. There's a belief that it will increase, and that will endanger public health, endanger public welfare.
What if the Earth were warming, but it wasn't humans that were causing it, it wasn't human-made carbon dioxide, but the Earth were warming, and these diseases would increase because of the increase in the vector-borne component? Would there be anything we could do about that? Would there be mitigating factors that we could bring into play? And the answer is, of course, we could. And I mean, none of this stuff happens in a vacuum. The fact that we might have more mosquitoes because the weather is warmer doesn't mean that we don't have anything else to use to impact that event. Is that correct?
Certainly, but that wasn't the question we were answering in the endangerment finding. We were asked whether changes, whether the pollution from greenhouse gases would change our climate, and if so, whether those changes endanger public health and welfare.
Okay,
and the answer
good.
was an affirmative yes. And
great. Well, then how many
that.
people have died from the effects of elevated carbon dioxide in the last decade?
Again, you don't have to have a number of people who have died in order to make a finding of endangerment. If I tell you that it's dangerous to jump off a cliff, you don't have to actually do it to know that that's a dangerous thing. It was a finding.
No, because someone else has already done the experiment and proved the theorem. But can you tell how many additional cardiovascular asthma deaths are linked to carbon dioxide increases of 100 parts per million in the atmosphere?
I think I've explained to you why that's not the analytical approach that was taken. We took a weight of evidence approach, as scientists have done.
Are you at the EPA doing research on this front currently?
We do some of our own research. EPA's Office of Research and Development has contributed 3 reports to the U.S. Global Change Program, but we also rely on our partners and on the peer-reviewed work of scientists.
And what are the results of those?
The endangerment finding is based on that work.
But you cannot provide us with numbers of how many people have actually been endangered. What about how many people died as a result of a 1 degree Fahrenheit temperature rise over the last 100 years?
I think I understand your point, but I think we're talking past each other at this point. I can probably quote what other scientists say, that the evidence is that ongoing climate change will have broad impacts on society, including the global economy and the environment. For the United States, climate change impacts include sea level rise for coastal states, greater threats of extreme weather events, increased risk of water scarcity, urban heat waves, western wildfires, disturbance of biological systems throughout the country, and I add to that the issue of ocean acidification, which is certainly not trivial.
Can you quantify the number of human deaths then from any one of those instances that you just cited?
The endangerment finding is based on the premise and the belief, I believe the scientific fact, that the severity of climate change impacts will impact negatively public health and welfare. And scientists agree that that severity is going to increase over time.
But then how can you be convinced, as a matter of science, that you'll be able to reduce the public health risks and hence the number of deaths from carbon dioxide when you can't quantify those specific impacts?
Well, I'm convinced of the inverse, which is that if the models show that increasing amounts of emissions of greenhouse gases are going to change the climate, that mitigation is one method. Mitigation of those emissions is one method of addressing it.